And so let us start with the first slide. Well, now you can see. Well, today we are going to speak to start a new module in the book. This is about explaining and reassuring. This is Unit 4. And before we discuss this unit, I would like to make some comments on the homework, your previous homework that you uploaded to the Moodle site. And I have already spoken about this, but this is just one more time because I see that not everyone just follow this rule. When uploading the screenshot, make sure to use the correct scale. Otherwise, it's hard for me to read it. Like here, I normally do not download your files to my computer because I can read from the screen. And if I see this scale, so it's impossible for me. I mean, I need to scroll down a lot and it's very hard for me. So that is why, please make sure that everything is readable and the scale is correct. Also, for example, I also need to download this file to the computer because the handwriting is very small and so the screenshot is poor quality. Just make sure that everything is okay and it will be easy to read. So think about this. Or there is another example, some students just did like this. So it's, yes, I need to do like, to bend my head. So I also need to download the file to be able to read it. So let us respect each other and do our best to make it easy for me to read. And as for the previous homework, which was, you remember, to write instructions, what the doctor says to the patient. Well, the key phrases that you should have used in the instructions are presented here on this slide. So now I'm going to insert the needle to the vein. I would like you to hold your hand still. So you see, we were speaking about the polite formulas that we should use in the conversation to a patient. Now, situated as now I would like you. So these phrases make just the instructions sound very polite. Or another example. Mr. Alex, could you please adjust yourself to a comfortable position? Yeah, that's it. Now I need you to stretch your hand for me. So other phrases like, could you please, or that's it, or for me. So these phrases were used in your instructions. And another example, if you don't mind, can I stretch your hand distally? Okay, thank you, now you, and so on. So if you don't mind phrase also can be used. Well, and most students understand the difference between describing the steps of the procedure to a doctor, to a colleague. They are given in short imperative sentences using imperative mood. And the difference of this and giving instructions to a patient where you use polite and simple language. So for example, like here, this number 5, 6, wash your hands, put on the gloves and prepare the things for the cannulation. And ask the patient to stretch the hand to put the IV cannulation in the hand. Is it, are these phrases from the conversation to a colleague or to a patient? Hello?
Patient.
Patient?
Colleague.
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 They sound like short abrupt sentences like instructions to teach somebody to do something. We don't teach patient, we explain something, the procedure to a patient. He doesn't need to remember, he just need to understand. And this phrase, I need to put the IV cannulation on hand. So if you could stretch your hand for me, please, thank you. This phrase is from conversation to a patient, right? Because here the polite language is used, and so it doesn't just sound like business-like instruction. So, and most of the students understand the difference between these two styles, but not everyone. That is why you see that some students have a score which is less than 10 points. So I just evaluated your papers like only half the score because you've done your job just looking for the information on the internet about the cannulation procedure, but you haven't adapted. You didn't adapt the instructions to the conversation to a patient. That is why you get less than maximum score, some of you. Okay. As for the answers to the questions, all the answers were good, and so everyone got maximum score for answers to the questions. Well, do you have any questions about this?
No.
I see. Good. Now let us move to the new unit, which deals with explaining and reassuring. And the first slide here, you can see the picture here. Look at the picture. Which procedure do you think is about to take place? Which procedure?
The ultrasounding.
Ultrasound?
Laparoscopy.
Yes, laparoscopy. So when you interfere into the patient's body, right? So
Yes.
with kind of medical equipment. And the question, what do you think the patient's reaction to the instruments and the situation would be? What's his reaction?
He or she would be panicked. For seeing these instruments.
Yes.
Firstly.
Right, exactly, yes. We would be scared, yes, just to decide when this.
Yeah.
What about the doctor's reaction?
Supposed to calm the patient,
Calm.
explain the procedure and calm the patient.
Okay, so Manish,
Yes, ma'am.
what would you like to say?
Yeah, ma'am, that's what. To keep the patient calm.
Yes, this is the doctor's job to explain and to to help him to relax and understand what's going to happen. And the question, do all patients react to instruments in the same way?
May
No,
or
ma'am.
No, ma'am.
No. What does it depend on?
On the patient.
The patient?
Maybe,
Yes?
yeah, because maybe it's not the
Experience.
first time patient is undergoing that
Exactly.
procedure.
What the patient already know about this procedure? Okay, okay. Well, if we move to the next slide. So you've called this procedure laparoscopy, right? Endoscopy, gastroscopy. Well, and you see here, we have to the left, there is a list of suffixes which are commonly used with medical terms. And to the right, we have a kind of definition, explanation of these suffixes, their meaning. The task is to match each suffix which describes a surgical procedure to the correct description. So let us start with Manish. What do you think of the first one?
removal of a structure by surgery. Ectomy.
Ectomy, this is removal. Okay, by surgery. Okay, ectomy. Well, then Pradeep, please. The second
Yes,
one.
ma'am. The act of examining, ma'am.
Okay. This is, can you think of any examples of medical terms with such suffix? Oscopy.
Endoscopy.
Endoscopy.
Laparoscopy.
Endoscopy.
Okay. Well, then let us listen to Rohita, number 3, ostomy.
Ostomy, an opening between two cavities at the outside.
And any examples? No?
Endostomy.
Endostomy. Okay. Well, let us listen to Bhuvanesh, please. Number 4, otomy.
Yes, ma'am. Otomy means cutting something open.
And example?
Hysterectomy.
Okay. Well, good. So there are a lot of specific terms in medicine, and so you know them better than me. Now let us have a look at the next slide. Here we are going to think of the stress pattern. I mean, these words are look like the same, but of course they have different meanings. And when we pronounce these words, the stress moves, we should understand which syllable is stressed in each of these words, in each of these terms. Does anyone have the idea about the stress in the words? Who can read them? Okay. Let us then listen to the pronunciation and analyze the stress. And you'll tell me if you hear or not.
Unit 4, Pronunciation.
Can you hear?
Yes, ma'am.
Yes, ma'am.
Unit 4, Pronunciation. Exercise 3. 1. Endoscope. 2.
Endoscopy.
3.
Endoscopic.
Okay. So what can we say about the stress? What happens to the stress?
It remains same in the last syllable. Like PEPYNIC.
Is the stress does the stress move from one syllable to other syllables?
No, ma'am.
Yes, I guess. Because in first word it's on P. Endoscope. It's on endos.
Endoscope. Which syllable is stressed? Endoscope.
And
The first syllable,
the
right?
first syllable.
Mhm. Endoscopy. Which syllable is stressed?
Scopy.
Endoscopy.
Endoscopy.
Dos, right? Endoscopy. And endoscopic.
Third syllable.
Third.
The third syllable is stressed. So you see the stress moves depending on the part of speech. So, and
Unit 4.
if we move to the next slide, now we're going to listen to 7 words, and we should write the words next to the appropriate stress pattern. We have 3 stress patterns. I mean, the first diagram shows that there are 3 syllables in the word, and the first syllable is stressed. The bigger circle is stands for the first syllable. In the second diagram, there is a word consisting of 4 syllables, and the second syllable is stressed. And in the last diagram, you can see that the third syllable is stressed. Now I would like you to prepare paper, and while listening, we'll listen to the recording just several times, and you should write the words in 3 lines, and then we'll check, okay? Ready? Steady, ready, go.
Exercise 4. 1,
Endoscopy.
2,
Proctoscope.
3,
Gastroscopy.
4,
Colposcopic.
5,
Gastrectomy.
6,
Proctoscopic.
7,
Gastroscopic.
Mhm. Well, did you write all 7 words, or do we need to listen for the second time?
Ma'am, second time.
Okay.
Yes, ma'am.
Well, please.
Exercise 4. 1,
Endoscopy.
2,
Proctoscope.
3,
Gastroscopy.
4,
Colposcopic.
5,
Gastrectomy.
6,
Proctoscopic.
7,
Gastroscopic.
Okay. Who is ready to read which word just matches with the first diagram? Let us listen to Rohita. Oh, Sohita, sorry. Sohita.
I think proctoscope, ma'am.
Yes, this is proctoscope. Proctoscope, right. Mhm. Now, the second line, let us listen to Afnan.
Yes, ma'am. It's an gastroscopic, ma'am.
How many words did you write on the second line?
For the second line,
1 word.
gastroscopic.
Which one?
Yes,
So,
ma'am.
which one?
Colposcopic, ma'am.
Khadija, are you here?
No, ma'am, endoscopic, I think. Endoscopy.
Yes. Endoscopy. endoscopy. Okay. Is this the only word that should be written on the second line? We have
I think gastroscopy.
Gastro.
gastroscopy and
Gastrectomy.
Gastrectomy, ma'am.
gastrectomy. Yeah. Gastroscopy, gastrectomy, and endoscopy. The stress is on the second syllable. Okay. Now, Khadija, what about line 3?
Ma'am, she's not here, ma'am. She's flying to Kazakh today, so she had a flight now.
Nice. Okay. Musharifuddin, are you here?
Ma'am, he is not.
Minus. Mayuka, please.
Ma'am, coposcopic
There should be 3
and
words.
proctoscopic
And
gastroscopic.
exactly. Yes, you're right. So here they are.
Exercise 4.
The words proctoscope, endectomy, gastroscopy, gastrectomy, colposcopic, proctoscopic, gastroscopic. So be careful with the stress. Normally the stress falls to the third syllable in a long voice that consists of just, for example, 4 syllables. Well, that is about suffixes. And let us focus on the medical instruments that are presented here. So we have 2 just types of medical instruments. One of them is proctoscope and the other is bronchoscope. What is the purpose of these instruments? What are they made for? What kind of?
Examine the inside of
lungs.
Yes, Rina, please. Rina?
Yes, ma'am. Bronchoscope is for lungs.
Examination. Okay. What about proctoscope?
Ma'am, it is used to test the rectum and anus.
Yes, you're right. Okay. Well, and now we are going to listen to some information. We're going to listen to an extract from a talk by Dr. Quinn. He's explaining how a gastroscopy is performed. And here there is the diagram that shows the purpose of this procedure. And we should listen and make notes about the 3 pieces of advice given to patients before the procedure is carried out. So anti-acid therapy, about eating, and about driving. So let us listen and you make notes about these 3 things. Okay. Now let's start.
Listening 1.
Once the procedure is explained to the patient, advice is given about what preparation is required before it is carried out. The patient is asked to stop anti-acid therapy for 2 weeks beforehand if possible. For eating and drinking, the patient is advised to take nil by mouth for 8 hours before the procedure is done, but note that water up to 4 hours pre-op may be okay. As regards driving, the patient is advised not to drive if sedation is involved in the procedure. A leaflet about the procedure is always given to the patient, and follow-up is also.
Okay, and now for the second time.
Listening 1.
Once the procedure is explained to the patient, advice is given about what preparation is required before it is carried out. The patient is asked to stop anti-acid therapy for 2 weeks beforehand if possible. For eating and drinking, the patient is advised to take nil by mouth for 8 hours before the procedure is done, but note that water up to 4 hours pre-op may be okay. As regards driving, the patient is advised not to drive if sedation is involved in the procedure. A leaflet about the procedure is always given to the patient, and follow-up is also...
Well, so what does the doctor say about antiacid therapy? Let us listen to Bhargavi.
Yes, ma'am. The doctor advises to stop to take anti-acid therapy 2 weeks before the procedure.
Yes, 2 weeks. Now about eating. Vidya, please.
Yes, ma'am. 8 hours before the procedure and can take 4.
So take meal by mouth, yes, before 8 hours.
Milk by mouth.
And about drinking water.
Drinking water, it can be up to 4 hours.
Before procedure.
Yes.
It is before procedure, ma'am.
I see.
Yes, ma'am.
And what about driving? Vidya?
Not to drive as sedations are involved.
Yes.
Sedatives.
Sedating is involved. Okay. And when the doctor was explaining the procedure, the steps of the procedure, what verbs did he use in his explanation? What grammar structure did he use?
Rise.
Grammar verb forms. The forms
Grammar.
Maybe
present simple.
Present simple.
present. He said, if you remember, the such phrases as is explained, advice is given, is done, is carried out, is involved. What do we call this kind of verb structures? So we call
Listening 1.
passive voice structures, right? So, and so the difference between in the use of active voice and passive voice, here there is like a couple of examples. The cat drank the milk. The cat is the subject of the sentence, and the cat did it itself, herself, himself. Yes. This is active voice. Drank, the sentence is used in the active voice. And in the second picture, you can see unhappy baby which is crying, and the sentence says, the milk was drunk. So it doesn't matter who did this, because there is no milk. So the milk didn't do it itself. Somebody did it with the milk. So that is why the passive voice structure is used. So was drunk, this is the passive voice of the verb. Well, and so I guess you remember this. Let us refresh. This is just while explaining some investigations or procedures, we can use the present passive voice. And there is the difference between active and passive. Active sentences say who is doing an action, and passive sentences don't necessarily say who is doing the action, though they can say this, but the focus on the action itself. And there is the structure of the passive voice presented here on the slide. The present passive consists of 2 parts. The verb consists of 2 parts. This is the verb to be plus the main verb with the ed at the end, if it is a regular verb, or it should be the third form if it is irregular, and to be should be used in 3 forms. For example, in the present, like am, is, are. for example, is carried out. Carry is a regular verb, so we add ed. Carried, is carried out. Or is done. Do is irregular, that is why we use the third form done. Do, did, done. Is done. So these are the verbs in the passive voice and the form of the passive voice. Well, and let us have a look at the information here. If we make up a positive sentence, we should remember that some verbs do not require objects. It means that we do not necessarily need by not necessary. Example with the active voice sentence. The doctor attaches the needle to the syringe. So doctor, the subject, does it himself or herself, attaches, active voice. And the passive voice, we replace the doctor with the word the needle, which was the object of the sentence. So, and it becomes the subject, and we change the form of the verb. It is the passive voice form. The needle is attached to the syringe. We can stop with this, or we can add by the doctor. So, and there is a note, we don't need to say who it is done by, because it is it is part of a procedure. We just say this, but we don't need the information about the agent, the person who does the action. Well, and the negative form. So the negative form is presented here if it is active voice. The example, the doctor does not use a tourniquet in this procedure, does not use active voice. The doctor does not use himself or herself. And passive voice, the tourniquet is not used in this procedure. So tourniquet just is placed at the beginning of the sentence, and the form of the verb changes into passive voice, is not used. Well, and so there is information about verbs requiring objects. So it is necessary to mention who does the action, and by is necessary here. In the active voice, only experienced doctors perform this procedure. Perform, active. And passive voice, this procedure is performed only by experienced doctors. Because without mentioning the agent, experienced doctors, the sentence doesn't have any sense, right? And negative, just sentences in the active voice. Nurses don't perform this procedure, and in passive voice, this procedure is not performed by nurses. So the context requires using by and mentioning the agent, the person who does the action. Well, and yes, now we are going to look at the sentences that describe procedures, and we should change the sentences into the passive voice. And we should decide whether they require an agent or not. Remember that agent is the person who does the procedure. How much time? We have about 2 minutes. So I think it makes sense to take the break now, and we'll continue after the break. Okay? So see you in 10 minutes.
Okay.